There we go. We are live. Okay, it's recorded. So, the topic today, guys, welcome. For those that are watching this recording, I am Megan, your coach, and this is Dr. Jean. For those of you who have not watched or caught some of the other video recordings that we've been doing, Dr. Jean and I met quite a few months ago, and I'll let him introduce himself a little bit for those of you that might just be popping in.
Okay. Well, thank you, Megan, for having me. My name is Dr. Gene Delucia. I'm board certified in family medicine. I hate to say how long. I've been in medicine for over 40 years. And I was trained in Western medicine, but I've gotten away from that. I got tired of being a pill pusher. And so we started looking years ago for better ways, and we have found them where I can actually heal people now. I can reverse the damage of all your cells and get you off your meds and actually get you healthy again. And now we know living longer, which is great.
Right. So tonight's topic, we're going to talk about supplements. And going off of what you just said was pill pusher as a physician. So what every time a client reaches out to me, it could be Facebook. It doesn't even have to be a client, but all day, every day, it's, well, what do you think about this? And my first response back is, well, okay, but why are you taking this? So,
And what is their answer? Well, I read something online, or my cousin told me
right,
about this,
someone
and it
told
helped
them about
them.
it.
Yeah, and that's really what it is.
Yeah,
So,
and that's how it always starts is they heard it from somewhere, yeah, or read it somewhere. And then that becomes, hey girl, can you mute your mic?
Oh, sorry.
No, you're good. Are you working out? I am so proud of you. Well, you tune in, girl. Get your workout on. Sorry, sidetrack there. Yes, I'm proud. Okay, so back to supplements. Yeah, so the number one thing is everyone always says, well, so and so's on it and it worked for them, or I read it somewhere and it shows promising results or whatever that it is. So then I find myself going down this rabbit hole of trying to educate of supplements. And then it's you have this repeating wheel turning all the time, all day, every day. So when you in your practice, how do you respond to patients, clients that are just wanting supplements?
sure. Well, I want to talk to them a little bit. What are we doing? What's a supplement? That means we're supplementing something that the body needs. Okay. So, how do you know the body needs that? How do you know your body needs that? Well, they don't. Okay. So, we like to measure. And there are supplements that I take. I mean, there are some things that I take and I recommend, but those are after we measure, levels and look at things. So we're bigger on that than we ever did in Western medicine. We don't do those things, but I want to measure nutrient levels. And I want to look at things before I just start to say, hey, try this and try that, because that's really all they're doing. Most people, if they eat a good, healthy diet, don't need most supplements. Okay.
Right.
Multiple vitamins. Most of those multiple vitamins are not any good anyway. If you're buying Centrum or one a day or anything, you're just wasting your money. You're paying for their advertising because they're
Right.
lousy vitamins anyway. But you're supplementing something. I want people to understand that your body needs something and it's lacking, so you're going to supplement it. That's what a supplement is. And we like to look at that. If you need it, fine. I like that we've gone way past that now. We can now activate the body. I can activate the gene expression back to your youthful level. It's millions of times more powerful than a supplement, vitamin, antioxidant, or any of those things. By turning your body's ability on to heal itself, we're essentially putting you back to where you were when you were a newborn, a very young child. Your body was growing, making new cells. You repaired yourself. If you hurt yourself or something happened, your body was very easy to repair itself. And our bodies are made to repair themselves. But as we age, we start to lose that ability. So what we're doing is we're putting people back to that youthful level inside cellularly, and we can repair everything then. And it's a better way.
Right.
So.
And how were you explaining earlier is, not using the Centrum, or what is it, the daily one for women or the
Right.
daily one for men, because there's two supplements I always recommend, and it's the base, because like you were saying, is I want to see what you're actually lacking in. So
Right.
am I looking at your food logs? Are you getting regular lab work done? That is how a supplement is truly going to work. And then, and not work, but because it works with things. You know, a lot of people think obviously two supplements the magic, but it's like no, it only works as good as your habits and what it's paired with.
Sure.
And
Sure.
and then it's okay. Well, then we get into quality. So they're like, well, why can't I buy a one a day for women's, and why should I buy the Trisynergizer? And it's like, okay, well, there's just like quality of foods, you have quality supplements, just like
Sure.
you know, pay, there's labeling misconceptions, if you will, and on our foods, the same thing happens in our supplement.
Sure.
So how
And it's not well regulated. That's
no
the other problem. It's just not regulated. So, but I see that all the time. I had somebody come in the other day. It brings this list of supplements and things in. I said, "Well, where are you buying your omega-3 and where are you buying your vitamin D? Because those are things we recommend for a lot of people." Well, I get it at Walmart. Eh, you're probably not getting the highest quality. you
right,
know.
like let's take a
Yeah, it's
step.
yeah. So
Yeah, the number
so
one, protein. So protein and some type of basic vitamin or herbal pack, which has become the Tri-Synergizer, are the two I recommend. Most Americans don't get enough protein. And then, of course, for any physique enhancement, weight loss, etc., protein has a lot of great research on it. So that, and then some sort of, like I said, herbal pack, vitamin pack. And I go into explaining why the Tri-Synergizer is 1,000 times better than any Walmart, GNC, even if it comes from Sprouts or Whole Foods, it doesn't matter. There's
sure.
a quality process that all these things go to, just like our foods do. So,
Yeah.
how do we choose these supplements?
Yeah, and like you said, the Tri-Synergizer is an activator. It's not a supplement or a vitamin, so it's millions of times more powerful. I'm activating my own body to turn it back on to where we were able to repair ourselves, and
Yeah,
that's really a huge breakthrough. Washington State University published a study calling it how this worked, which we call NRF2 activation. NRF2 is a protein messenger to about 500 of our genes they've discovered, called it the biggest breakthrough in the history of medicine. And it is. I mean, I've seen it over now almost 12 years. So exciting to be part of, exciting to see actual repair, actual reversal. And for us, we're very, very successful at getting people off their meds,
right.
myself included. At one time, I was on multiple medications. I haven't taken meds in over 10 years now. So but yeah, we've gone way past supplementing. We've gone way past giving you a drug for a symptom or a number, because that's
Right.
really what we do. So a lot more fun to actually have people come back and go, "Wow, I've got my life back." That's a reward.
That's
So
right. Other
yeah,
than a cabinet full of supplements that expire before you even use
yep,
them, and
and yep, we've all done it. I've done it
right, I'm
before I knew better.
exactly. I still got a few things in there too. So I'm like, oh, I
Yes.
got to throw this out. You know,
Yep.
we've all been there. We're guilty.
hmm hmm So
So
that is
what we
true.
actually talked about this the other day too. So I had a client, same thing, that they do the doTERRA um, supplements and products that they use, and they're like, well, you know, I'm doing that and the Tri-Synergizer, and it's like, yeah, but just because one ingredient that you read that doTERRA has that may be in this herbal blend, but again, it's how everything's paired. It's chemistry, you know. So
Right.
how everything is prepared, but also the quality of work. What factory was it in? Like what
Sure.
company was overseeing
Absolutely.
and regulating those things?
Sure.
Proprietary blends, that you know. So it's the percentages, like you said, like the studies that have been done on this is phenomenal. And the only two supplements, and correct me if I'm wrong, especially in your field, that I know of in my field, the two most widely known supplements that have a lot of research is creatine and caffeine.
Yeah, true. And caffeine, quite frankly, has a lot of benefits if you get the right caffeine.
Right,
So,
exactly. And
you know,
so like that. So someone will read something and be like, oh, so I need caffeine to lose fat and to lose my weight because there's tons of research out there that shows that. But it's like, ooh, but no, because again, how is it paired? What is your caffeine, the quality of it, how
sure,
much of it, and so
sure,
on throughout the day. But yet you're
sure.
complaining of anxiety and insomnia
Well, sure.
and
You're
now taking more
overstimulating your
supplements
sympathetic
to
nervous system.
counteract
Yeah,
the supplement
right,
you're
right.
taking.
Yeah. No, and I agree. And I drink a cup of coffee in the morning. I make sure it's organic. I put my MCT oil in it, so it's bulletproof. And then I take L-theanine so I can tamp down that stimulant effect of the caffeine because you're overstimulating your sympathetic nervous system if you're taking too much caffeine in.
Right.
So, there are ways to counteract that and still get the benefit. There's a lot of good benefits from the right kind of caffeine, the right kind of coffee, all
And the
those
right
things. And as you know,
dosage.
we have a what I'd like to call our smart energy drink that is got a natural form of caffeine, and they put multiple other things in it for brain stimulation. It's for neuron protection, neuron repair, focus, memory, energy. So it works very, very well. And again, I prefer that over, I don't drink Coca-Cola or Red Bull or any of those. There's
Right.
just too many bad things in
And
those
that's what I
drinks.
love about it is when I explain it to people because before I was so hooked on Celsius and which is a lot of caffeine, 200 milligrams, I believe, and a lot of
That's
B
a lot.
vitamins,
Yeah,
and green tea extract and a lot of feel good, if you will, um, enhancers. And that's why I loved Celsius because it wasn't so much of an energy drink. And then now flipping, it's like this is a way better quality of a
yeah,
supplement
yeah,
that I can get in. That really, it's not to me an energy drink, which is a supplement. It's just more of a focus, is how I describe
yes,
it because I hate the taste of energy drinks and I hate getting palpitations and the side effects that come
right,
with it. I want to be able to sleep at night. I don't want to take another supplement to counteract the supplement I'm taking during the day. So if you take
yes.
better quality supplements in the doses that they're supposed to be in, a lot of other signs and symptoms people experience
Yeah.
may alleviate.
Yeah. And we're all overstimulated. Our sympathetic system, nervous system is way out of balance with our parasympathetic in this country,
Correct.
especially.
Yeah.
We don't meditate, we don't relax, we don't calm, and then we throw in a whole bunch of stimulants, and boy, and it's not good for you. It
No.
just isn't good. I even have an app that I measure mine every day, so I want to see where I'm at. I want to make sure I'm equal and balanced. You're healthier if you are,
Right.
so
Yep. And it's choosing, again, quality supplements that help supplement and give you that balance of what you're truly missing.
yes,
So going
yes,
back into the study, so we have a lot of research on obviously caffeine itself and um, oh god, what was the other one? Creatine. But
great.
when other people bring me these supplements, and I'm like, show me. You can't show me any research on it. Show me anything in DoTerra that has backed research because I can't find
Yep,
anything. So if someone wants to bring it to me, I'll be glad to read it.
yep.
I had it was the last few years. I don't even know how long in my community. The supplements from I think it's called Thrive. I
Mm.
could be wrong. I don't even know, but everyone in the world was doing it. I think you know what I'm talking about. And it had like the wrist energy thing and all of that. And when you actually read the research studies behind it, and so again, going into supplements and how it's regulated, the US does a terrible job.
Yeah, it's
And
bad.
Canada and the UK have a much better, not better, I shouldn't, but theirs is a little more in depth sometimes with their regulations. So Canada, no matter what percentage ingredient is in there, it has to be listed. And
Yeah,
I was fighting research articles on this product in Canada and the UK that had nothing good to say about it.
Yeah.
But then when you
Well,
compared it to
yeah.
the ingredients on the US food label, they were
Yeah.
different.
Yeah. No, and I agree with you. I really want to see manufacture, the sources, all the things that make it healthy. I would like to see that. I mean, I want a company that's open, maybe it even has videos on that, and there are in this company. There's YouTube videos on manufacture. I'd like to see all those things because I want to know what I'm putting in my body.
Right,
That's hugely important.
right.
So, most labels on foods and everything are pretty misleading, so I want to make sure of it. So very, very conscious about that now.
Yes. Yes. So, and for those of you that are listening that are live or watching this recording, if you guys don't want to dive into research, that's fine. But this is why you hire professionals, any coach, any physician that should have some sort of base, and always ask. Never be afraid to ask, like, what's the research behind this? What are the trials like? So on and so forth. You
Yes.
guys should always be asking your healthcare
Yeah.
professionals those
And,
questions.
and I do tell them this, not the ingredients of the product. I want to see studies, published studies on the product,
Right.
because anybody can say, "Oh, look at these research. There's 10,000 articles on acai berry." Okay, but you've got acai berry, but it's not your product. Tell me about your product. Show me the research on your
On
product.
your product.
That's why
Right.
I love this company. These researchers, and these are independent researchers, not the company's researchers, which is even bigger. And
Right.
it's on that product. It's
Right.
not on. It's not on ingredients of.
Exactly. I end up diving down the rabbit hole of, okay, well, we know the benefits of, I say acai. I don't know how to, what the
I
whatever
think, yeah,
pronunciation
I
is,
think,
but I end up like going down the rabbit hole of, okay, well, how is it beneficial and what dose? And does your product represent that?
yeah, yeah.
And a lot of the times it doesn't. People
Yeah,
don't.
and I get that. I get approached all the time now. Hey, look at our product. This has published science. Okay, and I start looking up. I go, gosh, and I know where to look. And I'll get even on Google Scholar. Google Scholar weeds out the crap on Google,
Right.
but there's a lot of published studies there. Or PubMed. PubMed.gov is our government's repository of millions of scientific studies. There's nothing on those.
No.
So you can Google something, but hey, who puts it out there?
Right.
You know,
But I
you
think
just
I've
don't know.
already seen just from you, I can't even go. I love research articles. So with the
Yes.
Protandim Trisynergizer, I can't read enough. There's more and more
Yeah. It's
research that
amazing.
articles that I'm finding.
And, and ongoing research. I mean, when I see companies or organizations like the American Heart Association independently studying the products, LSU, Harvard, Ohio State University, University of Colorado. In fact, it was even developed at the university level. So that's what impressed me as a physician. I'm still a scientist. I really want to see the science and published proven science. That's what I want to see. So that's why I got involved, because I saw the science and I saw the breakthrough, what a huge
Right.
breakthrough it was medically. So pretty exciting to be part of.
Yes,
Pretty
it
exciting to be
is.
part of.
I know. I was like,
Yes.
I started getting more and more messages, and of course, everything cycles and phases. And it was, well, why this, and why the Trisynergizer, and it's like, we have to do a video on a broad
Yeah.
explanation. You
Yeah.
just
And
can't go buy
that's what it
vitamins
is.
from Walmart or
Yeah.
GNC because they'll be
Yes.
like, oh, well, the guy there, and I'm like, he's making a commission. He studied, and he makes a commission. And he makes more commission if he sells you the GNC brand as opposed to the other brands.
Right.
And then they go,
Right.
oh.
I know.
And it's like, that's why
I
he was
know.
talking you up on it.
But and I hate to say this, people are gullible and they tend to believe whatever. That's
Right.
why they
Well,
get
they
on
get really
Google. They
excited
believe it.
and relate to you, and then they go, "Oh, this guy, he works at a supplement store. He must be the professional." he must be the one that's going to give me my answers, or she.
He doesn't get paid a professional salary. He gets paid the salesman salary. So
Right.
uh,
With
yeah,
commission.
it's with commission. Yes, that's exactly right. So
With commission.
too funny.
Yes. So when choosing supplements, I always say, well, one, what is the goal? What are you
Right.
taking, the supplement for? Is it for some type of appearance, physique, weight loss, weight gain? Are you
Right.
struggling with, just anxiety? Do you want to sleep more? What is it? Are you trying to you just become healthy? What's like you have to
Yeah.
identify your first goal, just one, your main
Yeah.
first priority goal. When you get that in mind, then we can then go down the rabbit hole of what may come into your lifestyle. And again,
Yeah.
like you said, a supplement. It's supposed to supplement what you're not getting. Just like even with my patients, so I'm like, your oxygen is just a supplement, even oxygen, because you're not
Sure.
getting enough. It supplements what you're not getting.
Yeah.
So when I explain it that way, of like, well, if you needed oxygen, you would take it, right? And if you didn't need it and you actually took too much oxygen, you could end up with very bad effects.
Damaging. Yeah.
Yeah.
Absolutely. Yep.
So we don't want to just take supplements. And then it's like, but then you waste your bank account, you waste your wallet,
Yeah.
you
And then unfortunately, it doesn't work. You know.
and then there goes the pantry that starts stacking up.
Yeah. Yeah. So yeah,
So
you're right.
yes, number advice, I would say identify the goal, identify exactly what it is you're trying to do. Um, and then two, what to look for. Ask the healthcare professional, not just the salesperson or whoever it is you're talking
Right.
to. Talk to someone that's
And find a
qualified.
knowledgeable healthcare professional. But I hate to say this, but your Western practitioner doesn't know anything about supplements, herbs, or anything else. We're just not taught that in school.
No, and I still struggle with that, with my patients because they'll say, "Well, my doctor said it was okay," and I was like, well, that's fine. I'm telling you it's not okay. And this is why. And,
Yeah.
we go down the list, like, especially with the heart patients, you have specific, supplements you can't have that will counteract with your
Yeah.
medication, that will counteract with your exercise. And what I've come to find, especially in the last 5 to 6 years doing virtual coaching, is the healthy population isn't so healthy anymore.
No. And then we make it worse by putting them on drugs, and because then when we do give them certain drugs, now they've got to supplement some other things because some of those drugs drain your body of things you need, like CoQ10, for example.
Yeah,
Everybody that's on a
exactly.
statin for their cholesterol has to be on CoQ10 because it's depleting your body. And let's see, why am I giving you a statin? Oh, yeah, for heart health. What happens when I don't have CoQ10? My heart doesn't function. It doesn't make any sense.
My
It's
favorite
crazy.
is oh no, I don't have high cholesterol. And I'm like, because you're using this much statins, so it
Yeah,
makes your lab work look
makes your
great.
number go down. And here's the problem with suppressing cholesterol. That's your building block to all your
You're
other
supposed
hormones.
to, right,
I don't want to make mine too low. It's crazy. Let's treat the inflammation that causes the LDL to stick to the artery walls and damage it. Let's not just treat the number.
right.
That's crazy. And the doctors don't even measure the right things to even look for that inflammation. It's absolutely nuts. But
And then depending on obviously the doctor and the lab, the ranges
yeah,
are
true.
so different. And I have physicians out like, well, what range did they use? And I'm like, well, what does it matter?
Yeah, you know. Well, like I've said before, this is a disease care industry. Western medicine, we're not interested in curing anybody. We don't get paid for that. We get paid to maintain your disease for life. And the
Right.
more diseases,
Which is,
the more money we make. It's a
yeah.
sad
And that's,
state of
I think,
affairs.
where big pharma and supplements just became just like everything else, so profitable. Took it
Absolutely.
more, to just shove it. And hey, we can make like food. We have such a demand. We have billions of people, so we can make this drink from cane sugar and bottle it up and call it soda pop. and sell it really cheap because there's a huge demand now in America. And
And then we can put gluten free on it. Everybody will buy it.
yeah,
I know. I love it. I
what's
love
that?
it. So look at ingredients. Anything you buy, look at ingredients. If it comes out of a package, I tell people, probably not too healthy. Comes out of the ground, you're probably in pretty good shape, as long as it's grown properly.
I had a client literally message me one day a bottle of vodka and goes, "It says gluten free, right? So I'm good." And I'm like, "It's made from potatoes and corn.
Yeah,
Like,
potatoes
so
instead of grains.
let's just put a label on it and say it's gluten free, so
I
now
know.
we can sell more vodka."
And I'm sure it does. I'm
Yeah,
sure it does.
I actually saw the other day. I posted it on my social media. They now have a protein vodka.
So it's something they're adding to the vodka.
I guess it's got amino acids in with the vodka
So yeah, it's gimmicks. Let's do anything we can for gimmicks.
to
So
get more sales, to get more
more
profit,
sales.
and that's
Well,
what
that's
supplements are, and people
yep.
don't
Oh,
understand.
you're right. You're right. Well, we're here to educate.
But
That's
we're
what
here
we're
to
here to do.
educate and tell you guys to not buy them from Walmart.
Yeah, please.
Stay away from Walmart. Um, those of you, is there anything specific that you would like to touch on? So I'll leave to in the comments. So in the recording, you guys will be able to see this link as well to the Protandem Tri-Synergizer that Dr. Jane and I have been discussing in and out of this conversation. And what it is, and he can correct me again if I'm wrong, is he's much better at explaining it, is it's a pack of herbal blends that have been perfectly concocted, if you will, to activate your genes for specific purposes, which
Yep.
lowers oxidative stress. Our first video that we did, I want to say maybe a month or two ago, was explaining oxidative stress, damaged cells. And at the end of the day, all diseases are driven by that and inflammation. So
Yep.
rather than just supplementing our body with more than baloney bogus supplements, anyways, how can we correctly reverse this damage, actually activate the cells in our bodies through a means of other than just exercise in our food? What's out there? What can we do? And Dr. Jean has worked. I want to say you've been using this for 10 years, 10-ish years,
Yeah, probably about 11 now. Yeah. Yep.
on both himself and his patients, and have seen amazing results. And like we've been discussing, is the research is there, and anytime you look, there's got to be a quality, just like our food industry. You need to look
Yes.
for quality, and when it comes to supplements, it's just as important. Yes, their money does, what is the saying, money does talk, or whatever. Like, if it ends up being a little bit more, odds are there's a reason why. And typically those companies charge more for regulations, for research purposes, because they're going to beyond measures to get the best ingredients. And what a lot of people don't understand is you guys will pay an insane amount, arm and a leg, for Starbucks coffee.
Yes.
And again,
Crazy.
going back to caffeine, the number one, other than creatinine or creatine, supplement that creatine and caffeine is the number one like studied supplement. Starbucks, the reason why it is so expensive, at least going back at least 8 to 10 years ago, is because they go to specific mountains at a specific elevation level with specific farmers for their beans, and they pay the farmers directly. So on a business standpoint, again, this was about at least 8 to 10 years ago. That was the moral and ethics behind their business plan, was choosing the best absolute coffee bean, so they can charge that price, and they pay the farmers directly, which I don't know if that's still the case anymore. So it's like, if you guys spend so much money on your Starbucks caffeine, imagine if you put that money towards a supplement or an herbal blend that would actually help you.
And I agree. I mean, what is your health worth to you? Are you willing to spend $2 a day or $3 a day or $4 a day? You're willing to spend that on your Starbucks. In fact, most people spend more than that.
Right.
Certainly my health is worth more than that. Yeah, absolutely.
Yep. And just that one Starbucks drink, depending on how big big it is, usually they're pretty big up there. You have all the sugar
Oh,
that's driving your disease, whether it be, oh, am I on? Okay. I
yeah, you're on.
completely blanked out. So you have the big Starbucks cup that has all the sugar that drives your disease, whether it be thyroid, cancer, you name it. It drives it. It drives inflammation. And then you have the caffeine on top of it. So most people that complain of irritability, anxiety, insomnia, you're just piling it all in, and then you spend hundreds of more dollars on supplements that don't work for you. So what if you
No,
could take all that away by simply introducing one thing into your daily routine?
no. And that's exactly right. Simple, uh, proven, effective. I've seen it in over 10,000 people now over the past 11 years. So it's a lot of fun to be part of. It's 21st century medicine. We can actually repair at the cellular level. So we're working at the core of the problem, not just the endpoint.
Yes, exactly. So we're gonna wrap this up. Do you guys, Veronica? Well, I know you're working out, girl. Oh, she logged off. If you guys have any questions for those that are watching the recording, please reach out. Dr. Jean's also available as well. We can do phone calls, chats, whatever is
Hmm?
necessary to answer all your questions. This is the, I brought the Tri-Synergizer. This is the box, actually. So, and if you open it up, go down in there, it's a pack. So it looks like this
And
on the outside, but then these are, I take them every morning. And again, how vitamins are paired are everything, there is a timing too. So I do have a lot of people that are watching this that have thyroid. So make sure, and correct me on this, is you still want to take your thyroid medications and still wait at least 45 minutes to 4 hours before you take these, correct?
well, your thyroid, if you're taking thyroid medicine, should be the first thing in the morning on an empty stomach.
Right,
Those I recommend people taking with their first meal. You absorb it better with the meal.
right.
I take it with my bulletproof coffee, my omega-3, things like that. I eat in a narrow time window, so I don't eat breakfast, but I do have that in the morning. So, those are things that we can, educate people a little bit more on. But yeah, you're right.
Yeah.
Uh,
80%, I would say 80, 90% have thyroid. But so I usually end up taking it first thing in the morning, like first thing, or with my lunch if it's because I'm now cut on my thyroid. I only take it 3 days a week now.
good.
I just had
Excellent.
another checkup. Everything's perfect. So I'm still continuing. So on the days I take my thyroid, I take it at noon at lunch. So it's a good space in between. So yeah, and that's it. That's the only supplement that I take, technically protein powder, and then if you caffeine technically is a supplement. So other than that, that's all I'm on. And I mean, especially in the fitness industry, you get pushed creatine, you get pushed, the typical fat loss diet pill, you get pushed diuretics, you get pushed BCAAs, all of this thing. And it's like, when you actually sit down and look at the research, there is no research that backs any of
I
it.
want to see longevity research. I want to see, uh, you know, reversal, cellular reversal. Let's reverse the damage. Let's let you live longer and healthier. Isn't
Right,
that the goal?
right.
That's the
And
goal.
I want to
So,
hear the people that's and reading in the videos and all the people that's been on it is I want to talk to the real people of how it's helped them,
yeah,
people
yeah,
that's been doing it long term, such as yourself, that have experienced getting rid of their pantry of supplements and just
true.
replacing it with something that's so simple.
Yeah, I agree. So, well, very good. And if you're interested in
Well,
the product, certainly talk to Megan. She can help you with those things. So,
yes, I will. Let me know. Please reach out, guys, for the recording. I am Megan. I'm an exercise physiologist. This is Dr. Jean, and we are here to help educate you guys and help make the community healthier a little by little, day at a time. So please reach out to us. Thank you, Dr. Jean, so much. And you
Megan,
have a great
thank you.
evening. And everyone else have a great evening as well.
Good night.
Bye.